Why does sigmoidoscopy focus on the rectum and sigmoid colon? Imagine a window into the lower part of your digestive system that can help catch problems early. That's what a sigmoidoscopy does by examining the rectum and sigmoid colon. These areas are at the very end of your large intestine, right before waste leaves your body. The reason doctors focus on these regions is because many polyps and early signs of cancer tend to develop there. These growths can start small and without symptoms, making early detection vital for successful treatment. The sigmoid colon is shaped like an S and connects the descending colon to the rectum. It's a common spot for abnormal growths because of how waste moves through and how cells can change over time. During a sigmoidoscopy, a flexible tube called a sigmoidoscope, which has a tiny camera at the tip, is gently inserted into the anus and guided through the rectum into the sigmoid colon. This allows doctors to look for polyps, inflammation, or other irregularities. Because the procedure only involves the lower part of the colon, it is less invasive than a full colonoscopy, often requiring less preparation and usually no sedation. This focused approach makes sigmoidoscopy especially useful for screening for colorectal cancer, which is one of the most common cancers worldwide. Detecting polyps early can prevent them from turning into cancer. It's also helpful for investigating symptoms like rectal bleeding, persistent diarrhea, or abdominal pain. For people who might not tolerate a full colonoscopy due to health issues or personal preference, sigmoidoscopy offers a practical alternative. However, it's important to remember that sigmoidoscopy only examines the lower part of the colon. If abnormalities are found, a full colonoscopy might be recommended to check the entire colon for additional issues. This targeted focus on the rectum and sigmoid colon is based on scientific evidence showing these areas are common sites for early disease. Regular screening and early detection through procedures like sigmoidoscopy can save lives by catching problems before they develop into more serious conditions. Always consult with a healthcare professional to determine the best screening options for your individual health needs. Medical guidelines emphasize that screening should be personalized, and early detection is key to maintaining colon health.